This will be a demonstration of a potential medical assessment scenario. I learned that I've been dispatched to a 65-year-old male who's having chest pain. First thing I want to do, scene safe, BSI. I want to make sure this is my only patient. I'm going to restate the mechanism of injury, which in this case, or nature of illness in this case. Nature of illness would be chest pain, a medical event. I also want to make sure that I call for any additional resources at this time. So I do want to ask for ALS, since this is chest pain, it could be cardiac in origin. So I want to get ALS on the way. As I come in, I want to form a general impression on my patient. Remember, in the real state testing, you'll have a live patient who will be acting out a scenario. In this case, we're going to say that I've got a male who's clutching his chest as I walk in and looks to be having some difficulty breathing. So I'm going to go ahead and say that I have a fairly poor general impression. I also want to decide whether or not I need to take C-spine control. In this case, I see no evidence of trauma. I talked to him, he hasn't fallen or anything, so we're going to forego C-spine control. Hi, my name's Rob, I'm an EMT. I'm here to help you. Can you tell me what's going on today? And he reports that he's having chest pain. I ask him, have you ever had this happen before? And he tells me that he has experienced this before several years ago when he had a heart attack. Right off the bat, I want to tell my evaluator that he's alert on the AVPU scale because he answered my questions. I know he's got a patent airway because he's talking to me, and I also know he's breathing because he's talking to me. I can do a little bit further assessment through watching him, his actions, possibly taking lung sounds if he's having difficulty breathing, to assess the status of his ventilations. Now, since I'm in airway and breathing, I want to go ahead and decide fairly quickly if I want to go ahead and put him on oxygen at this time. Since it may be cardiac in nature and he is clutching his chest and chest pain, I do want to go ahead and advise the evaluator that I would put him on 15 liters O2 non-rebreather at this time. Moving on to circulation, I know that he's got a pulse and a heartbeat because he's talking to me and he's alert, but I do want to check to see if he's got a pulse, especially a radial pulse, because that'll give me an idea of his blood pressure or his perfusion. And the evaluator states he does have a weak radial pulse, but it is there. In circulation, I also want to assess skin color and temperature, and my evaluator advises me that he's cool and clammy, which tells me that that this is fairly serious. The last thing on circulation is I want to make sure he doesn't have any major bleeds. If I need to, like in trauma, I can sweep any areas that I can't visualize, make sure he doesn't have any major bleeds, and he doesn't have any. So I do not need to treat for major bleeds. So I've taken care and assessed quickly airway, breathing, circulation. At this time, I want to go ahead and make a call as to whether this is a priority patient. And I do feel that this is a priority low-to-go patient because he is having clutch and chest pain. I find out that ALS is on the way, but they're about 20 minutes out, so we're not going to waste any time. I'm going to go ahead and call for the stretcher while my EMTs are going, my helper EMTs are going to get that. I want to go ahead and continue on with my assessment. My next step, once again, if I have a live talking patient, I'll be conversing with them. I want to go through my OPQRST. Onset, sir, when did the pain start? I found out that it started about 20 minutes ago. He was watching TV, watching a football game when it started. P, palliative and provocative. I want to know, does anything make it better or anything make it worse? And he says, since the pain started, nothing makes it better, nothing makes it worse. It's pretty constant. OPQ, quality, I want him to describe what it feels like. Sir, what does the pain feel like? And he advises it feels like a car sitting on his chest. Radiation, R, I want to know, does the pain go anywhere? He says it radiates down his left arm, goes into his left arm, his neck, and his jaw. Severity, sir, on a scale of 1 to 10, 10 being the worst pain you can imagine and 1 being no pain at all, where would you rate it? And he rates it as an 8, so it's fairly severe. And finally, T, time, he already kind of alluded to that about 20 minutes ago while he was watching a football game. Now I want to go through sample very quickly. Signs and symptoms I can see and I'm still working on. A, allergies. Sir, are you allergic to any medicines? Find out he's allergic to allergies. Are you allergic to anything else other than medicines? He says nothing other than some hay fever problems, that's about it. M, medications. Sir, do you take any medications on a regular basis? And he states that he takes a high blood pressure medicine, he takes aspirin, low dose daily, and he has nitroglycerin as needed, but he has not taken any yet today. Okay. Medications, L, last oral intake. I want to know, when did you have something to eat or drink at last? And we find out it was about 2 hours ago. E, events leading to, once again, we know that he was watching a football game and this came on about 20 minutes ago. At that time, I want to go ahead, once again, I'll have a real live patient. I want to actually take vital signs, report what I find to the evaluator, and they'll report back the vital signs that pertain to the scenario. So I would take a pulse rate. Once again, you're going to have a clock with a second hand in the room. I'd take it for about 30 seconds, multiply by 2, or 15 seconds and multiply by 4. But I report what I find. We're going to say it's 72 on this patient, but they report for the scenario it's 80. I'm going to actually take a blood pressure. So once again, on my live patient, I would physically take a blood pressure. Of course, I've got a mannequin here, so I'm just going to simulate. We'll say that I get 120 over 80, and they report for the scenario the blood pressure is 136 over 84. I'm just going to leave that on because I might take it again. You get a respiratory rate. Once again, count the breaths over about 30 seconds, multiplied by 2. I report that his breaths are at about 16 per minute. They report that that's correct, that it is 16 per minute for the scenario as well. I've already done skin color and temperature. Can listen to lung sounds. Going to listen bilaterally in the upper lungs and bilaterally at the lower lungs, lower lobes. And I report clear lung sounds. They report that his lung sounds are clear for the scenario as well. All right, at this time, we're going to say that the stretcher has arrived. We're going to go ahead and move him to the stretcher. Once again, since the patient has had nitro, or does have nitro of his own, since this does appear it could possibly be cardiac in nature, I could go through, sir, does it make any difference if I touch around your chest area? He reports that it doesn't, so that leads me further to believe that it could be cardiac. It's nothing muscle, pulled muscle related. We're going to go ahead and call med control to see if we can treat this patient by giving him aspirin, low dose aspirin, and assist him with his nitroglycerin. What we would find out as far as giving aspirin, I first want to know, is he allergic to it, and or does he have any active GI bleeds? Because if he's allergic to it or has GI bleeding, upper GI bleeding, we cannot give the aspirin. He already told me he takes it daily anyway, but we want to make sure. Remember, with any medication, we want to have the right patient, the right medication, the right dose, the right route, and the right time. As far as the nitroglycerin, before I give nitroglycerin or call med control, I want to make sure that it is his nitroglycerin, that it's in date, and that he meets the criteria. His systolic blood pressure was above 100, it was 136, so we're good there. And remember, anytime you give nitro, you also need to ask if the patient has had an ED, erectile dysfunction drug, if it's Viagra within the last 24 hours, if it's something like Cialis or Levitra, which is longer acting, in the last day and a half or 36 hours. He has had none. So at this time, I would advise the evaluator, I would contact medical control to ask to give the aspirin and the nitroglycerin. I tell him I've got a 65-year-old male. He does have a history, past medical history of cardiac problems and high blood pressure. He's had a heart attack in the past that we found out. And he does have his own nitro. His blood pressure is 136 over 84. And we're requesting to get permission to give 2 to 4 baby aspirin and assist him with his nitroglycerin medication. Advise the evaluator advises the medical control, says go ahead. Remember, in real life, medical control, we always want to repeat back to make sure we understood. So, sir, I'm going to go ahead and have you take these 4 baby aspirin, just put them in and chew them up. So he puts them in and chews up the baby aspirin. At this time, we're going to assist him with his nitroglycerin. It's going to be 1 dose under the tongue and let it dissolve. Sir, I'm going to give you your nitroglycerin. If you will put that in your mouth and under your tongue and let that dissolve. Remember, anytime we give a medication, we want to observe for the desired effect or any side effects and repeat vital signs and see if the medication did what it was supposed to do. By now, we're on the stretcher, we're in the ambulance, we're on the way to the hospital because this was a load and go. If ALS can intercept, that's great. If not, we'll keep going. We always want to do a reassessment, reevaluate airway, breathing, circulation, retake vital signs. I would want to know what's his pulse now, what's his blood pressure, what's his skin color and temperature. We could also, if we had a pen light, check his pupils to make sure that was okay, and his respiratory rate, and keep an eye on lung sounds. We find out that his pulse rate is still at 80, blood pressure is now about 110 over 70, so the nitroglycerin did drop it a little bit. If we didn't get orders to give nitroglycerin at certain intervals, like every up to 5 minutes apart, then we would have to call med control to get orders for another dose. Otherwise, we would need to check the blood pressure and make sure it stayed above 100 systolic in this case to be able to give him the subsequent doses if we got permission from med control to do that in the first place. We transport to the hospital, we continue to monitor, and at that time, after getting the second set of vital signs, we could finish our station.